The role of the nurse leader in quality healthcare, improving emergency department patient flow, presented by Christina Cooke, Liberty University. With an increasing number of patients seen in emergency departments daily, there is a significant need to improve patient flow and increase quality and safety measures. Due to the overcrowding seen within emergency departments, there is an increased risk for patient safety errors as well as delayed treatment leading to decreased patient satisfaction ratings. To improve patient outcomes, nursing leadership within emergency departments should magnitude the need for improved throughput to minimize the risk of medical errors, missed treatments or delays in treatments, and decreased quality of care. This writer has identified the issue of overcrowding and unsatisfactory throughput within a busy emergency department in Richmond, Virginia. As this issue fails to meet organizational standards and poses significant risk to patient quality and safety, this writer believes there is a tremendous need for remediation. Specific issues this writer has identified would be a lack of flow between ambulatory patients who arrive through triage and the initial screening and bedding of these patients. These issues are secondary to overcrowding, delaying of patient treatments, patient holds who are waiting for admission bed assignments, and lack of available providers for screening. Although this department has a strict policy against ambulance diversion, and in the 2 years that this writer has been working within this department, it has yet to go on diversion, the repercussions of not diverting lead to increased nurse-to-patient ratios and workloads, putting patient safety at a heightened risk. In response to patient boarding, nurses within this department are faced with the challenge of caring for critical patients who require intensive care unit bedding, in addition to the remaining patients in the assigned zone who also need interventions and close monitoring. During this sort of increased influx of patients, there is inevitable outpacing of available resources, creating potentially dangerous situations for patients and staff alike, highlighting a significant need for quality remediation within this emergency department. This issue is currently monitored by HCAHPS in relation to patient satisfaction scores. Corporate sets specific metrics related to mission and values, core measures, throughput metrics, and emergency department dispositions. This is also measured by assessing patient outcomes and the occurrence of avoidable patient safety events. The emergency department has recently implemented several changes that are focused on improving patient flow and throughput. Such changes include increasing physician coverage at night from 1 to 2 providers, increasing implementation of mid-level provider screening Monday through Friday between 9 a.m. and 4 p.m., and a newly implemented metric of a goal to collect labs within 30 minutes of an order, including the urinalysis, which is often delayed within our department. Another change aimed at improving throughput is the current construction within the front end of the department to increase the amount of sub-chairs available to implement a horizontal and vertical split flow model that will allow the assessment of medical management of patients with less severe conditions without utilizing a patient bed. This department has also implemented a staffing position known as Triple T, standing for trauma, triage, and throughput. There is also a nurse assigned to the pit area, which is the area behind triage where patients will be screened and managed in chairs so that medications can be administered more efficiently and the flow and throughput will be enhanced. Nursing leaders are responsible for ensuring quality, safe patient care and by improving operational, organizational performance to increase reimbursement and efficiency. As emergency department overcrowding is seen to decrease safety and quality outcomes, reimbursement rates will decrease, as will the patient satisfaction. Although focused strongly within the emergency department, throughput is a significant issue hospital-wide that affects length of stay and diagnostic-related groups related to reimbursement requirements. Specifically in the emergency department, overcrowding leads to increased wait times, increased length of stay, and patients who leave before medical screening and against medical advice. These are all key factors that negatively impact organizational financial stability. As employee satisfaction is also seen to decrease with unsatisfactory patient flow and working conditions, nurse turnover rates are bound to increase. With an increased need for orientation for new nurses as a result of such turnover, this is also anticipated to be a financial repercussion of unsatisfactory throughput. As overcrowding in the emergency department has been identified as a national crisis leading to increased rates of mortality, the Institute of Medicine and the Joint Commission have enforced quality improvement initiatives that measure and set goals for mitigating and managing the need for improved patient flow. The Joint Commission has clarified expectations of increasing patient flow by clarifying the requirements of nursing leadership. This includes accurately measuring and setting goals regarding medical inpatient holds and to communicate more effectively with healthcare providers and local authorities, which will better foster coordination of care for the psychiatric patient population. For example, in the best interest of the patient, the Joint Commission has established a guideline recommending that the holding time frame should not exceed 4 hours once the decision to admit or transfer has been made. This writer has experienced holds up to 3 times that parameter and endorses that it poses great risk to the well-being of the patient and the efficiency of the entire department. Another recommendation of the Joint Commission is to utilize observation units near the emergency department where patients are transitioned to a more permanent inpatient disposition, freeing up available beds in the emergency department. Effective nurse staffing within an emergency department is key for administrators to consider. As ED throughput metrics are often equated to ED performance metrics, nurse staffing within an emergency department is seen to enhance triage capabilities, medication administration, and the delivery of interventions while reducing nursing delays that prohibit the facilitation of discharges. Increased nurse staffing could allow for quicker assistance with toileting, more efficient pain relief by administration of medications, less feeling of being rushed, and a more intimate caring experience provided by happier nurses as the workload would be appropriately distributed. As one of the possible solutions to relieve emergency department throughput and to decrease overcrowding, ambulance diversion aims to lessen the input component to reserve ED resources. Another significant consideration is the prevalence of ED boarding of admitted patients secondary to lack of available inpatient bedding. As patient boarding of admitted patients, sometimes ICU level priority, within the ED reduces the availability of beds for patients arriving through via ambulance or through triage. This also hinders the ability of staff nurses to accommodate and timely provide care to other patients requiring immediate interventions. Although ambulance diversion is not guaranteed to fix overcrowding, during times of critical capacity, occasionally utilizing this option could significantly decrease overcrowding, increase quality patient outcomes, and allow for safer, more efficient care to be provided. Although strategies in place are effective in mitigating patient flow, the department needs further innovations to increase throughput, quality care, and patient satisfaction. This writer believes the improvement of nurse staffing as opposed to only increasing physician or mid-level coverage could significantly aid in the resolution of this crisis. As a preceptor, this writer has identified that by increasing the availability of nursing assistants or team nursing within an assigned patient zone, interventions are provided more effectively and efficiently, and the door to admission or discharge time is shortened. As far as the split flow process, the department has not mastered this flow model yet, as patient workups are often initiated in this holding area with patients requiring cardiac monitoring and bedding, but due to the patient boarding of admissions, there are few available rooms and delayed flow. As far as ambulance diversion, our organization is currently strongly against this idea, and corporate has strict regulations against its allowance despite a lack of available resources and safety and quality concerns. Ambulance diversion decisions should be made with caution, as it is a common yet controversial topic of interest. It is also important to consider the moral issues related to ambulance diversion, as the most important stakeholder is the patient. Specific evidence in the literature has shown increased mortality as a result of acute myocardial infarctions, as well as financial repercussions such as annual revenue losses of millions of dollars. This is to be viewed differently than emergency department closure in response to a disaster, as even when an emergency department is forced to close, the term isn't accurate because care may still be provided to those in need in parking lots or tents. Furthermore, as a nurse leader, it would be communicated that as a Level 2 trauma center, it would be ethically important to remain open for trauma patients, stroke, and MI patients for quality. Without adequate nurse staffing and poor working conditions that lead to medical error and nurse burnout, higher nurse turnover is seen to negatively affect care quality, raise organizational costs, and increase the workload of remaining nurses. The financial costs are related to the hefty costs associated with orientation of new hires. Furthermore, nurse retention is essential to patient throughput, as retaining nurses who are experienced and confident with the flow process of the department is vital to the success of quality progression. As a leader, I would handle these anticipated challenges by increasing effective communication and welcoming suggestions, hosting meetings with staff members as well as administrative representatives that could express concerns to corporate. As well, the most important factor to this writer is to consider the patient's safety and quality outcomes above all else. By utilizing experience and gained wisdom while remaining cognizant of department processes, nursing leaders can implement the role of a competent nurse navigator within the emergency department to support the delivery of care and the facilitation of efficient patient movement. Nursing leaders should also integrate new technology that provides effective management. This type of technology can help staff members appropriately prioritize patient condition severity while ensuring that patients do not get missed or lost in the process. Nursing leaders are responsible for evaluating data and metrics to contribute to the planning process, encourage staff engagement in the facilitation of changes, and effectively communicate expectations to minimize pushback. Furthermore, it is essential to identify potential causes of poor and efficient patient throughput, such as lack of communication, resource constraints, shortage of nursing staff, and lack of evidence-based guidelines. As a healthy work environment is essential to ensure quality and safety, nursing leaders are responsible for maintaining an environment that excels in effectiveness and efficiency. As a competent nurse leader, it's important to implement evidence-based interventions to enhance nursing practice and patient outcomes. Although it is challenging to develop an efficient and effective staffing and delivery model within the emergency department, it is essential for nursing leaders to plan, implement, and encourage sustainability to enforce the positive change in culture. While evidence supports the dire need for improvements in patient throughput, many hospitals have yet to identify it as a priority, and there is much room for leadership to engage in process improvement techniques. By examining the throughput processes of the organization as a whole and reducing variance, nursing leaders can successfully influence increased organizational flow, causing improvement in patient satisfaction, quality outcomes, and employee retention and satisfaction. That concludes this presentation. Thank you very much.